Hello, hello. The title of this talk is Helping Your Sinuses. It is currently spring 2025. The trees have started flowering, and the first lot of the sufferers with sinus issues, hay fever, are just beginning to trickle into my osteopathic practice because the poplars are flowering and various other trees are about to start flowering. And that kicks off the allergies for those people who are sensitive, and they end up with sinus pain, headaches, feel lethargic, eyes stream, etc. All the typical symptoms that you might be aware of. So, what can you do about it to help reduce the symptoms and have a happier life in the process? Because you can't stop the trees flowering. There are a series of things to do that will help. Some of them are dietary, some of them are massage directly to the sinuses, and that I'll be telling you about, and there are other things too. I do offer, as a cranial osteopath, a 3-series sinus treatment program, and you might also be interested in that. If you are, go to livingelements.co.uk and you'll find me, Gayle Palmer, able to give assistance, and you can book yourself in as well. So let's begin. Where are the sinuses to start with? There are 5 different sinuses in total. There are maxillary sinuses, and they are just underneath the eye. They're quite big. And sometimes the roots of the tooth on the upper mandible go right up into the sinuses. There are 2 frontal sinuses up here. And then there's a sinus right at the back, which you can't get to. It's effectively at the back of the throat, and that's another area of issues. The sinuses themselves are air-filled cavities or sacs almost, but they can get infected. And when they get infected, that's when the problems begin. They can also be reactive to certain agents in the air in particular. Pollens are notable, dust, other things. And some people are more sensitive to some chemicals than others, so they can then be reactivated at that point. And you basically have a histamine reaction, which your body doesn't like, and causes you pain and discomfort, etc. So to help this area of your face, it's really the mid-face area that we're concentrating on, we need to realise that all of the facial bones and the skull bones are actually always moving. And as they do so, they help our sinuses to drain with each in-breath and out-breath, and they have their own inherent involuntary mechanism of movement as well. And that's what helps keep them healthy. But they all drain right up through little holes right in the base of the nose here, and they're really tiny holes. Now, when you have an infection, or you don't have a very large ostia or hole in that location, and one side might be worse than another, then you are much more susceptible to infections. When you get an infection, the usually clear liquid, which are in your sinuses, starts getting thick, mucousy, can be infected, which means it might be yellow or even green, might be a little blood specked, which is really bad news. Now, if you are allergic, you can, of course, take antihistamines, but they will make you drowsy and have other side effects. And it might not be enough, because there are mechanical reasons why these are not working, as well as chemical reasons. So we're going to work on the mechanical reasons during this video. So take 2 fingers either side, and you're going to put your middle finger over your nail of your index finger, your pointy finger, comme ça. And you're going to start off by rubbing just on the inside of your nose, just below your eye, gently in small circles, and then gradually work your way out along the rim of the eye socket bone, which is part of your zygoma. And you're working out all the way along, ignoring any wrinkles and crinkles. To help get the drainage in these areas improving. The lymphatic drainage from the eye is quite complicated, and that is what takes most of the tissue fluid away from your eye area and your sinuses, which are deeper to that. So you've done your little circles at the bottom, then you're going to do your little circles up over effectively the eyebrows, around the top of the rim of the eye socket itself. And you can be quite firm, which is why we've got our fingers reinforced. Now the good news is that this shouldn't take all that long to do. It's one of the things I think about exercises is they can become a chore if you don't like doing them or you don't feel you've got time. It's a perfect exercise for doing whilst you're sitting on the toilet. Top tip. Then, again with our fingers crossed, we're going to do some tapping along the sinuses. And again, you can be quite firm, but the secret to this is to allow your wrist to be quite springy. So instead of thudding into the sinuses, you're literally tapping and bouncing off them, if that makes sense. Right up towards the frontal and zygomatic and temporal junction here, which is often quite sore and can lead to sinus type headaches. And then we're doing the same thing over the frontal sinuses. Oh, I've got all out of sync. Oh, the dog wants to come in. Never mind. Okay, so when you've done that, we're then going to look for two little notches either side. One is the supraorbital notch, and it is literally just at the top of it's a little bony notch at the top of the eye socket here. And if you've got sinusitis or eye drainage problems, it is often exquisitely tender, so go gently. It's really easy to find either with your thumb or with a finger. And you're going to do some little teeny tiny circles in around there. And you can do some more holding type. So push and hold and release, hold and spring release. And then we're going to go to another lymphatic drainage point, which is just underneath the eye. Again, if you have sinus issues, it will be sore and tender. Very easy to find though, just below the corner of your eye. Again, firm circles, about half a minute or so. And then sweeping movements, either with one or two fingers, it doesn't matter. Underneath, just underneath the rim of the eye, of the socket. And the same up here. So now you're really stretching the sinuses. Stretching the skin, changing the lymphatics, changing the blood supply locally. If this area gets quite red, that's absolutely fine. It's not a problem. So the sinuses drain up into this area, and some of them drain partly into the lymphatics, kind of behind the face a bit. So by freeing up these areas, which is part of the drainage system for the sinuses, that will take a lot of the pressure away, help the fluid to drain better. You might well find while you're doing this, you get a glob of mucus in the back of your throat. Suggest you spit it out rather than swallow it, but it won't be the end of the world. Your stomach acid is quite capable of dealing with that. So the whole thing takes a few minutes. It's not awful. You can do more tapping, and you can do this any time of the day. I highly recommend that you have plenty of water afterwards and stay hydrated, because all of the changes that are required need to have water in order to take effect. And then lastly, you can just do some smoothing, massaging type movements and sweep up just gently. You're not trying to exfoliate anything, just allowing the drainage to improve. So I hope that that's been helpful and gives you a little bit more relief. There are other things that you can do, and if you join me for a 3-session cranial osteopathic session, I will go through those with you because they're more personalised. Hope that's helpful. Find out more information or to make appointments, go to livingelements.co.uk. This is cranial osteopath Gayle Palmer. Bye bye for now.